Hi, my name is Angie and I'll be your student nurse today. So we're gonna provide privacy, do hand hygiene. Alright, can I get your name and date of birth?
Isha Patel, August 28, 2002.
Alright, check your wristband. Alright, so I'm just gonna ask a couple questions. Do you know what year it is?
2023,
And do you know where you're currently located?
at the hospital
And do you know why you're here?
for a checkup.
Okay. Alright, so with my patient answering all those questions, I can note that she's alert, oriented to person, place, time, and situation. Her hearing is intact because she answered the following questions. Patient keeps great eye contact. Do you wear glasses by any chance?
Yeah.
Glasses, okay. And do you have any trouble hearing or
No.
no hearing aids?
No.
Okay. So patient's hearing is intact. Patient does wear glasses. And patient's speech is clear, and I assessed that all by the way she answered the following questions. So now I'm just gonna move on to head, eyes, ears, neck. Alright, so I'm just gonna start by inspecting the head, saying that her hair is evenly distributed, the colors are appropriate for ethnicity, I don't see any scars. Is it okay if I palpate? Alright. And there's no lesions or masses. And just looking at the rest of her body, hair looks evenly distributed. Also, patient looks groomed and dressed appropriate for the situation. Going ahead and assessing the ears. Her ears look symmetrical. They're intact. Appropriate skin color for ethnicity. I'm just gonna take a look inside. And the mucosa is appropriate for ethnicity. Alright, so now I'm going to move down to eyes. Can you just look straight forward for me? So the pupil size is 3. Alright, so I'm just gonna shine the light. Alright, so patients' pupils do dilate to light, to indirect and direct light. Alright, and can you just look up at the ceiling for me and look back down at the pen? Alright, so her eyes do constrict towards the accommodation. And eye color is appropriate for ethnicity. Alright, and just looking at her nose, it is intact, symmetrical midline of the face. Have you had any troubles breathing? No. Alright, can you just look up for me? Alright, so just looking on the inside of the nose, the mucosa is pink, moist, and can you push down on one side and other side? Alright, and no trouble
No.
with that? Okay. Alright, now we're gonna move down to the mouth. Can you open for me? Just gonna take a look inside. Alright, so patient's mucosa is pink, moist. She has all of her teeth. There's no teeth decay, no tooth decay. Do you have any difficulty swallowing?
No.
Alright, can you just swallow for me? Alright, so moving down to the neck, patient's trachea is midline. Now I'm gonna check for JVD. When checking for JVD, I would put my patient at a 45-degree angle. Alright, so I see no JVD. Alright, and I'm just gonna touch, making sure there's no enlarged masses or anything. Alright, and I'm just gonna go ahead and check the carotid pulse. Okay, so patient's carotid pulse is 2+, which is normal. Now we're going to move down to we're gonna go ahead and do the cardio. So, have you had any chest pains? Alright. So I'm just gonna listen to your heart. I'm gonna start off using the diaphragm. Alright. And we're gonna start in the right second intercostal space, listening to the aortic. And then over to the left second intercostal space, listening to the pulmonic. Down to the third intercostal space, listening to the Erb's point. And then can you lift for me? And then down to the fourth intercostal space, listening to the tricuspid. And then over to your fifth intercostal space, listening to the mitral. All right, and you would listen to that for a full minute. And then you flip to the bell side to listen to any S3 or S4 or any brewing sounds. So going through the same pattern, second intercostal space on the right for the aortic, over to the second intercostal space on the left for the pulmonic, down to the third intercostal space for the Erbs, and lift for me, down to the fourth intercostal space, listening to the tricuspid, and then over to the fifth intercostal space, listening to the mitral. So with that, I didn't hear any abnormal sounds. I didn't hear any S2, S3 or S4. S1 and S2 were present. Do you wear any, what's the word?
Pacemaker.
Yes, do you wear any pacemakers? Okay, so now we're just gonna, listen to lung sounds. All right, and just when I touch you with the stethoscope, just take a deep breath for me. All right, so we're gonna start at the right upper lobe. Going over to the left upper lobe. Going down still in the left upper lobe. Over to the right middle lobe. And then can you cross your arm for me? Listening to the right lower lobe. And then going over to the left lower lobe. Then we'll do it posteriorly, starting on the right side, listening to the right upper lobe. Over to the left upper lobe. Down to the left lower lobe. And over to the right lower lobe. All right, so patient's breathing is normal. I didn't hear any wheezing or any abnormal sounds. I would note that the patient's respiratory rate was 16, and breathing is eupnea. Difficulty breathing. Runny nose.
No.
Okay. All right. Now I'm just gonna move to checking the upper and lower extremities. All right, so I'm gonna start by just assessing skin temp. So skin temp is warm. Now I'm gonna palpate edema. All right, and patient doesn't have any edema. We check capillary refills. All right, capillary refills is less than 3 seconds in the fingers and also less than 3 seconds in the toes. And just taking a look at the nails, patient's nail bed is flat. The nail color is normal for ethnicity, and they're groomed appropriately. So now I'm going to do your pulses. Starting with the radial pulse, doing bilaterally, and they're 2+. Going down to the posterior tibia, which is also 2+, and then down to the dorsopedialis, which is also 2+. And then I would note my other places for pulses are the auxiliary, the brachial, and the femoral, and then the carotid, which we already assessed. Have you had a cough recently? No sputum. Alright, so even though you haven't had a cough, I'm just gonna go ahead and educate you on 2 things. So to start off, this is our incentive spirometer. So you'll take the tube, you'll inhale, hold it for like 2 to 5 seconds just to make sure that you're reaching the designated amount on the tube that the doctor has prescribed for you. And you'll do this every hour for 10 times or every commercial break. All right. And then the other thing to educate you on is turn, cough, and deep breathe. So every 2 hours or so, you'll turn to one side, cough, breathe, then you'll flip to the other side, do the same thing. Have you recently had any falls, bumped your head, or anything? Alright, so still gonna educate you on the glaucoma scale. The glaucoma scale is used to really just check patients, make sure there's no brain injury. And we use it, the 3 categories is motor, verbal, and eye opening response. Alright, I'm just gonna go ahead and move down to your abdominal or gastro system now. Alright, so with this, I would have her laying flat, and I would just inspect her stomach, making sure that her skin is appropriate for ethnicity, making sure there's no lesions, wounds, bumps, no scars or anything. When's the last time you voided? Urinated? Use the bathroom?
20 minutes ago.
Okay, and the last time you had a bowel movement?
This morning.
This morning, and you passed gas, right?
Yes.
Okay, so now I'm going to listen to her bowel sounds. Alright, so we're going to start down in the right lower quadrant, going up to the right upper quadrant, over to the left upper quadrant, down to the left lower quadrant. And then I'll do it again, listening on the bell side and just listening towards the midline, making sure I don't hear any bruise. Alright, so I didn't hear any bruise or any abnormal sounds, and patient's bowel sounds are normal active. Alright, so before I palpate, have you had any pain in your abdomen? Alright, so we're gonna start right lower quadrant and then go up to the right upper quadrant, over to the left upper quadrant, down to the left lower quadrant. Alright, and at any time did you have any pain? Alright, so I would state that the patient doesn't have any enlarged masses. The last thing I want to educate you on is our braiding scale. So with the braiding scale, we just kind of educate our patients just to prevent any skin breakdown. So mobility, we just try to ask that you stay as mobile as possible, because of course sitting down, laying down for too long could cause skin tear. Then just like I said, just staying active, not staying bedfast, bedridden, because all of that leads to friction and shear. So any questions for me? All right, so the doctor will be in with you shortly. You're just gonna go ahead.